Welcome my friends to my channel. I'm Bob Schrupp, physical therapist, providing you with physical therapy treatments and exercise that you can do within the privacy of your own home. It's do it yourself. Give it a try. Okay, today we're going to talk about after you've had a total knee replacement, and let's say you're having some difficulty getting the bend in your knee that you'd like. I'm going to show you some tricks, show you some of the things that we try with patients in order to get more bend. I'm going to move the camera down so you can see my legs. So while we're doing this treatment. Okay. Alright, the first one is the old standby. I'm going to pretend this is the knee that had the knee replacement. And of course you probably have learned this one already, I'm sure. You put a towel on the floor and you're going to of course get it warmed up. Working that joint. And then what you're going to do, first off, we recommend that people are doing this, if you're on your own at home, at least 3 times a day for 5 minutes. Alright, and what you want to do is every so often you're going to take the other leg and cross it over around the ankle and pull it back a little bit. Alright, if that gets too easy, and that's every so often, pull it back. If that gets too easy, then you can actually take the heel and put it on the toe of the foot and push it back further and further. Now everybody probably knows that one, but what you may not know is what we call the contract relax technique, which means is you tighten the muscle and then you relax it. So what we're going to do is we're going to use the other leg as a resistance, this one right here, and it's going to stop my leg from pushing forward like this. So right now I put this leg in place and now I'm trying to push this leg forward, but I can't because this one's not letting me. After I do that for a couple seconds, I then relax and I actually use this leg to try to push it back further. So I'm tightening the leg and then I'm relaxing, and while I'm relaxing, this leg is pulling it back. Okay? So tighten, relax, tighten, relax, tighten, relax, and hopefully you go further and further. Now if you find that one a little difficult to do using the other leg, we just have our patients take a belt, you make a loop at the end, loop it through the belt like that. Well, you probably won't be able to do it that easy. We're going to slip down, put it around the ankle like this, and now you're going to use this arm to actually pull the leg back. So now you might be able to see better. Now I'm trying to pull the leg away from my arm, and when I relax, I'm going to pull it back some more. Push, relax, push, relax, push, relax, push, relax. That's contract relax technique. Again, I'm holding this with my arm, holding it like a wild stallion, and the leg's pushing and I'm relaxing. Push and relax. Push and relax. Push and relax. Every time I'm pushing, I'm trying to push the leg straight like that. Another method that you can use, in this case, you're actually going to get one of your tennis shoes or something with a good grip on the bottom of the shoe, and in this way you're going to do it the opposite direction. You're going to actually plant the foot, and now you're trying to move your butt forward. Hold it there for a while, let it stretch. Feels okay. Plant the foot, go further forward. Plant the foot, go further forward. Is that too much to tolerate right now? Back off a little bit. Try it again. Plant the foot, go forward. Plant the foot, go forward. Put the foot further back, plant the foot, go forward. Again, this all works really well. I'm now going to show you a technique that you can do on the stairs. Okay, here we are on the stairs, and what you're going to do, here's the bad leg again, or I shouldn't say bad leg, it's the operated leg, of course. And what you're going to do is you're sitting on, 1, 2, 3, 4 steps. I got my grippy shoe on, and what I'm going to do is just try to lower myself down to the next step. Now if that's too hard for me, I put the foot maybe more towards the edge of the step, and then I try to go down to the next step and hold. Now once that feels okay, I might go back up again, move the foot back a little bit more, and go down to the next step again. It's just a different way of doing what we just were doing basically. You're trying to plant and get a little stretch on there. Now you can move again more towards the next step. You can keep this one straight too if you want, if that helps. And you can even work down further and further. You know, this probably would be too far for most people. But it's, again, it's just a different way of going at it. With all these, you want to make sure it's okay with your therapist first. I've seen a couple people have good luck with this one, but more people have luck with the first two that I showed you. Give this a try. I appreciate your comments below. If there's any other videos you'd like me to do, please put it in the description below, and please subscribe. Also, I am going to be doing a video on how to straighten the knee after a total knee replacement, so you may want to look for that. Thanks.